think that the pandemic really just dumped some gasoline on the mental health crisis in young people.
Jake Ernst hears from young people regularly about the challenges they now face after COVID-19 changed the world.
I am really concerned about the decline in friendship right now. Overall, kids are just having less and less connections.
Canadian researchers are also concerned about trends they are seeing in emergency room visits for young people.
More kids are struggling now than they were before the pandemic.
Clinical psychologist Dr. Sherry Madigan and her team looked at data from 18 countries, comparing numbers of ER visits from before the pandemic and then during, up to July 2021. While there was a 32% decrease in pediatric ER visits for any health-related reason during the pandemic, there was a 22% increase in children and adolescents going to emergency departments for suicide attempts and an 8% increase in visits for suicide ideation.
There's research to suggest that only about a third of them get any type of services after they leave the emergency department.
There are also challenges for long-term support.
About a quarter of kids who go to the emergency department for a suicide attempt will actually go back to the emergency department within 6 months for a similar mental health concern.
While a recent study suggested the effect of the pandemic on global mental health was relatively limited, that study focused on clinical data and did not have fulsome data on children.
So we had data on adolescents, but virtually none on children, so under 12 years old.
But experts say that kids spent more time alone, and some studies indicate screen time doubled.
We are seeing a lot of kids just go inward. When we don't have practice, when we don't have exposure to practice, as it maps on just with the current global climate, I think it's really decreasing their ability to handle and become resilient in the face of stress.
Katherine Ward, Global News, Toronto.